Yes, good afternoon. Dr. Yaffe is on a call with our federal, provincial, territorial partners and discussing aspects related to early warnings and how to deal with the looking to the fall and how to deal with a potential wave 2 and different steps and how each province and territory are putting their plans in place as we have done. And this weekend, it reminds me it's 6 months since our first positive case back in Ontario, noting that we got our first alert to our Council of Chief Medical Officers of Health on the 2nd of January from the federal government. And so a lot had gone on already in January, and then more went on after that. But even those 6 months, reflecting back of how we have had to change, shift, and move as the global pandemic presented different challenges to us in Ontario, and how our teams and many groups gathered and formed together, maxing up to now we have a whole command table with 43 sub-tables. All the time there's well over 800 to 900 different people putting input in, experts and specialists to that direction, organizing and giving advice to me, and then putting that forward up to government decision makers. So it is a big machine. It's moving. People are putting in huge hours. And that's people from the medical field, from our experts and scientists, all the different government sectors, as they deal with the many different components that make up Ontario. As complex as it is and as big as it is, it requires a multifaceted approach, including that of the 34 health units around the province of Ontario that do their part, and working with the local municipalities and councils to give a coordinated response as the situation presents, changes, and moves, as we want a ready and resilient system to respond in Ontario. So as I said, everybody's made big sacrifices, but we're only coming down out of the first wave. And you'll see some numbers today, and I'll talk about that. We're already preparing for the fall. What does that mean? What's it going to be globally? You see some countries that have been in remission for a period are now surging back up again. How do we avoid that? How do we make sure that doesn't happen? We can't be overconfident. We have to plan, have to ask the advice of all our experts, our modelers, and different ones that come to that table that help to put forward a comprehensive message and direction to assure Ontarians that we're doing our part, but just as important, as you've seen the impact, you need to continue doing your part. And I'll talk about that in a moment, why that has been, will be so critical as we go forward. Our cases today. Well, we've had some jumps in the last week as we deal with outbreaks and some data entry issues. We're back down to 103, where we were down in July the 15th at 102. I realized that 102 was a bit artificial, as there was a data entry changeover with one of the health units. So it might have been a bit higher than that if the data had flowed. And now it's part of our surge up to the 160 numbers later in the week. But if you look at those numbers in Toronto, only 24, and they've stayed down. Windsor, Essex still has 23, and I'll comment on that in a moment. Peel down to 15, which is encouraging. Ottawa coming back, their increase down to 14. Niagara having 10. And a lot of the health units, 28, have fewer than 5, 21 with no cases reported. Those numbers, as we saw the jumping around, there was some outbreaks. Ottawa with the social gatherings of younger people, but as we asked the acting medical officer of health there, said yes, there was young people, but there were some people over 50 who were having gatherings, social ones, without adhering to the principles of public health that we have asked for. And at the same time, in Windsor, Essex, while we have been monitoring the ongoing issue in the farms, we've had some more outbreaks in some community groups, and we are moving extra resources down there to deal with that. Other medical officers around the area are assisting, as well as their staff, to help them on their ongoing and steady challenges they deal with that matter there. Meanwhile, 14 other health units are meeting in an outbreak investigation coordinating committee to look at farms writ large and doing testing and assessing. Is there other problems in other areas? Yes or no? So far, it's encouraging. They have not found too much in other areas outside of the southwest Ontario. Meanwhile, in Ontario, a number of people are resolving. 33,960, that's nearly 90% of the cases have resolved in Ontario. There are still people in hospital. 154, that was an increase of 26. Some of those have been recently admitted, 5 in southwestern Ontario, related to a certain community group. The number of people in ICU is 35. That's down to, I would say that's pretty well stable. And those on ventilators was up to 21 in those patients in the ICU. Still, while we monitor the deaths, we're fortunate as of yesterday there was no deaths reported, and our total is 2,755. But we still want to keep monitoring that situation. The lab testing has continued to meet that target of the 20,000. We did 26,000, nearly exactly, yesterday with a positivity rate of 0.8%. So we have continued on that trend and are monitoring that, and a lot of hard work by our wider laboratory network and people doing that data collation and entering. It is no small task, and I really thank them for their ongoing dedication and day in, day in, with many extra hours put in to give us these reports on a daily basis. We're seeing on our weekly data came in, as usually it is at this time, the trends continue to be down, which is good. Our number of cases reported in a week is the second time under 1,000. We are still a little bit more than the week before, but that's encouraging that we keep in that trend moving down. As we look forward to maybe have a day, I think as the Premier commented, we might have a day of less than 100 cases in the province of Ontario. Still, the proportion recently of the cases, that means the percentage of those positive, even if it's a smaller number, are in the 20 to 39 age group and followed up by the 40 to 59 age group, while the ones in the over 60 to 80 have continually dropped off, and we're not seeing very many cases in that group at all. In that, the deaths for the overall week had not exceeded 100 for over 7 weeks now, and it's now not over 50 for 5 weeks in a row. Again, positive directions and aspects we see there. The co-exposures, some still travel, surprisingly enough, 3.1%, and outbreak is mainly our main one with 52%, and close contacts of those as well. And we still have our percent that is following with epidemiological linkage and to identify missing cases. So our overall message is that while we're having many groups working on there and public health units continue to work in the outbreaks in the respective jurisdictions, I've talked about the outbreak in social gatherings in Ottawa, coming back down, containing. There's the ones in Toronto where they're following the outbreak at a certain company, Purolator, and identifying cases and contact management there, bringing those numbers down. Windsor, Essex, trying to bring down the farm ones and the community ones with the extra help of our emergency measures team down there to assist in that, and working with community groups to see how they would like to work with us to bring that under control for the protection of their members as well as their vulnerable citizens in that group as well. So the message is that we're doing well. We continue to move out to stage 3. We've announced that. There'll be more moving out as of midnight tonight. As we move to stage 3, as I said all along, while we open up more things to do, they're not without the constraints. And some people seem to be forgetting that. That means the social distancing, the masking in public places, somewhere mandatory in various health units where they want it in certain settings. And we trust that as one of the advantages of Ontario, where we have 34 health units. They can write those orders in conjunction with their municipal officials to do what's best in their area, knowing that we have a huge province with a big geography, and it's not all the same in every setting. That means also when we open up these settings here, we ask them to still maintain hand hygiene. If you're sick, stay home. If you don't need to go out, don't go out. That all stays, even in stage 3. And some people feel in some of the settings, and I've heard lots of discussion about bars and restaurants. Bars and restaurants were not allowed to be open as you did back before COVID. They have the same restrictions. The 6-foot distancing, people in social circles only at the same table, family members. You have to wear a mask in some places coming and going. You don't get up and wander around. There has to be proper layout by the organization, the management, of how washrooms are used, not crowded. Bars that are attached mostly to restaurants now, also bars, no singing, no karaoke, no dancing that. Those are not the way they were before. That's part of the reality. And we're asking those ones to say, if you're going to open that context. Demonstrate to us that you can put all those prevention things in place, that those people feel they want to enjoy that event or area. It's not for high intake or for lack of social adherence to our policies. Each MOH is going to monitor that in their respective jurisdictions, and if they have to put more restrictions on, as the Premier said, they can do that with a Section 22. So all this time through the stage 3, as we open up. We're saying there's more available, but you have to have the same precautions. You have to do the same public health measures. The only thing that's changing there is the indoor gathering of 50 and the outdoor of over 100. Still, those have to have the same public health measures, the same distancing, masking, hand hygiene. All those things are still in place. That's part of our reality of living in our COVID world for the next while. You can do more and more, but do it more and more carefully. And the social circles and aspects that we're going to try and address and see if we might alter that to assist. All this is very critical as we consider all the province going to stage 3, hopefully some in August. And if that community transmission keeps going down below 100 and down, that means it's safer for schools. Because if it's in the community, it can go in the schools and vice versa. This is an investment on a go-forward basis that everybody has to make. So it's not to be taken casually, because your casualness can put other things at risk. And we need you to stay the task. And I really appreciate the work that Ontarians have done thus far in doing that. And the evidence is in the numbers. But we still have outbreaks. And some of those could have been prevented, should have been prevented. And we still need to work at that. So those are my comments there. And with that, I'm going to open up for questions from the media.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question.
Your first question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. Just checking in on that increase in the number of hospitalizations today. Do you know, is that a blip? Is that what caused that?
The hospitalizations, I mean the total number, or I said in one area where there was 5 hospitalizations?
Yeah, the number went up by 26 today, which seemed like a lot. So I was looking for some backstory on that.
I don't have the details of around the province which centers in there. We continue to have some individuals noted and sent in, especially with some outbreaks. And that just emphasizes the fact that even though our numbers are coming down, our positivity is coming down to 0.8%. And the number of hospitalizations for a while has backed off. It doesn't mean that just because you get COVID now, you may not suffer consequences that require hospitalization assessment, because some of those hospitalizations are probable or suspected until they work the person up. Because there are other things that can mimic COVID, but are still there, and they have to be taken seriously. There can be shortness of breath and issues like that that could be part of an early myocardial issue. So these have to be brought in, but the default is, say, if they have symptoms that are similar to COVID, put it on suspected as COVID until you rule it in or rule it out. And so that hospital is made up of that combination. So I don't have the details of breakdown around the province, but we can get those if you need them.
Follow-up?
I'm good, thank you.
Okay, next question.
Ladies and gentlemen, as a reminder, should you have any questions, please press star 1. Your next question comes from Chris Inting with CBC Windsor. Please go ahead.
Thanks for the reminder on star 1 there. Dr. Williams, you mentioned about Windsor Essex and the farm testing there. Earlier this week we had heard that 19 farms have been tested with on-site testing. 5 more were scheduled. That was early in July, and then we heard that that number hadn't changed as of Monday. Why has the province shifted away from that on-farm testing, or that decision was made? What was found out to slow that down or to stop that for the period of 2 weeks?
The main reason for pausing, I'll use the word pause because it is starting back up again. There was some sense from our Ministry of Agriculture, Food and Rural Affairs Ministry that the communication to the farm owners was a bit confusing. They weren't sure what did the testing mean. When it did cause isolation, what did that mean? How did that curtail services? And there was some questions and things brought forward by the farm industry saying, we need some clear messaging of how this is going to happen, what's going to occur in that regard. So the Ministry of Agriculture, Food and Rural Affairs have put together a toolkit, which they put online yesterday, and so that the farm owners have quite a comprehensive document so they can see ahead of time if you're going to ask for the mobile team to come into your farm and do testing, you can see what the expectations are and understand what impact it might have on the operation of the farm and the working and the staff, etc. And of course, making sure that's communicated, perhaps in Spanish or other language, to your workers so they understand what it means as well, because it is their choice to get tested or not get tested. So it was more of a pause to improve the communications and coordination to assure we're working in sync with the farm owners so they understand. And of course, the ultimate goal is the protection, the health and safety of the farm workers and the owners as well on a go-forward basis, and using our mobile clinics in that way, or mobile testing programs in that manner. So that was paused, but that's now back up and starting to be rolled out again.
Follow up, and this will be the last question.
You had mentioned that there's people in place now trying to review how to do this moving forward. Is the goal to test every farm in Windsor-Essex, to have every agricultural farm worker tested?
That was one of the initial goals, is to go around because we've seen cases where there are positive that were unidentified, that were either very mildly symptomatic or asymptomatic, and then because of the congregate living situation could lead to and has led to wider infection among those in those congregate settings. And while some may have had some mild or moderate symptoms, every now and again a person may be impacted with more severe consequences and hospitalization. And as you remember in the past, we've had some deaths associated in that region. We don't want to go there again. We'd like to get ahead of these ones as quick as we can to ensure that we not only have a safe workforce, but one that we can say is COVID-free on a go-forward basis, because it's going to get busier as the harvest seasons are coming in different aspects. So our people, our ministry staff at OMAFRA are very concerned about that, as are the industrial agricultural owners and operators.
Thanks, everyone.